Welcome to the Unofficial Sex Therapist,
where we dive deep into the world of intimate relationships and explore topics related to sex, sexuality, communication, and personal growth. Join us as we navigate through the complexities of human intimacy and provide insights, real experiences, advice, and expert interviews.
Whether you're seeking guidance or simply curious about the fascinating realm of sex, our podcast offers a safe and non-judgmental space for exploration and education.
Tune in and let's embark on a journey towards a healthier, fun, and more fulfilling sexual life.
Welcome, everybody. Thanks for joining us for another episode of the Unofficial Sex Therapist. Tonight's topic, we'll be talking about sexual health and ways to increase your performance and better having a better enhancement in your sex life. Tonight's guest, we have one newbie tonight. We'll have another guest that's going to be joining us shortly. But my first introduction of my guest tonight is going to be Gwen. Miss Gwen, how you doing?
Hello, everybody. Hello.
And my second guest, we have Miss Selena. Y'all remember Miss Selena from the Poly Amore episode? That was a hot and fiery episode. So how you ladies doing tonight?
We're doing good. Well, I'm doing good. How you doing?
I'm feeling great.
You doing good?
So we'll start with letting Miss Gwen tell you a little bit about herself and her background. So that's where you'll know from the angle that she's going to be approaching our conversation tonight about sexual health.
Okay, guys. Most of you may know me, some may not. So I'm intimate. But anyway, I'm a nurse of 27 years, so I have a lot of background on health and wellness when it comes to sex and sexual performance. So I'm going to be talking at a standpoint of nursing, health-wise.
So from a more of a medical
standpoint.
a medical.
Mm-hmm.
And Miss Selena, you tell the viewers a little bit about you.
Sure. Well, I'm Selena. I'm originally from Chicago, born and raised, Chi-Town.
Yeah.
I know, right? Basically, I've been in Texas for April 10th would be my official third year as a resident in Texas. I'm a level 3 officer. Providing public safety, whether it's a house, a car, garage, parking lot, or a person. I'm here to provide safety, as long as I'm on duty. Otherwise, you have a problem.
And she like that too. I think when she on duty, when she off duty, she off duty.
Absolutely, you have a problem.
So if you fall out or something like that, she gonna turn around and walk off.
Yeah, make a phone call for you at least.
Yeah, I'm gonna make sure you're straight before I leave, but I'm gonna protect me.
Right. So let's get into what we're going to be talking about tonight. One of the things that I've done, because I've done some research as far as sexual health is concerned, a lot of it really kind of plays into your mental and definitely physical health. And when we talk about physical health, we're talking about what?
We're talking about circulation. We're talking about your diet. Exercise. We're talking about medications, even genetic factors.
Right.
That can, that can actually hinder your performance and can be devastating in the bedroom.
Yeah, because the thing is that, both individuals and couples at some point in time are going to experience some interference or some level of difficulty when it comes to their libido and their performance. It may not be for like the younger folks, the 20s and 30-year-olds, but usually you start seeing things happen once the person actually gets into their 40s, late 30s, 40s and 50s, where women are actually starting to experience menopause. And I always kind of think that men have their own kind of version of menopause. It may not be it's called a menopause.
I really did a little research on that too prior to coming and see what the stats are.
Right.
That when this starts happening.
Well, okay, so before we jump into anything, my third guest that's here tonight, Mr. Reggie is on, and I think I'm ready to go ahead and bring him on Let's see. Here we go.
Hello.
Hey, how you doing, Reggie?
Doing fine. How are you?
I'm doing great. Reggie's from Tennessee. You want to tell the viewers a little bit about you?
Well, uh,
Don't be shy.
I'm 55. I'll be 55 this year. My name is Reginald Aviehart. I work for Domtar Industries. I've been on this health journey since I was like 39, 40, when I realized I let my health go, excuse the language, to shit. I
Was it
was
bad? Was it bad?
I had high blood pressure. I was pre-diabetic. My cholesterol was all over the place. So they was trying. I've never been the one to take a lot of medicine. So I was like, I can't do this. I can't do it. So I started, and here I am. I'm 55. I take no medicine. I've never been in the hospital for anything. Nothing.
Good job.
That's great. Thank God. Thank God. I mean,
Yeah.
you're a walking testimony, and I think that's really that lets people know that hey, you don't have to be a victim of circumstance, things happening. Or you don't have to sit back and just allow diabetes and heart disease to come into your life and think that you can't overcome those things. You know, uh,
Yes.
I take medication now, and when I say I hate it, I absolutely hate it. I hate it. I
Yeah.
hate it every day. Um, so let's get back on topic. So when we were talking about pressure, as far as men and women are concerned, men feel things. I know men. I know I've experienced and I've seen where men they develop some level of anxiety, and also women I think develop a level of anxiety when they feel like they're not able to perform. Um, and some of the mental health I think reasons behind it too could be from depression, anxiety, or having some form of trauma from their past or past relationships that also contributes to that. Have you noticed that as well?
Oh yeah. As far as the when you mean the decline in sex, it,
Yeah. So I think it can go both ways. If a person is going through, if they're depressed for reasons outside of the bedroom, I think that can also affect their sexual
oh, the
performance because
effect.
their mind, because mentally their mind, they're thinking about other things. They could be having issues
It's
financially.
actually a term for that.
What?
It's called performance anxiety.
Okay. Yeah.
It's
Oh
it's
wow.
it's it's actually a real term called performance anxiety.
Okay.
And yeah, so especially if you're up and down, you're not having any control over your erection.
So we're talking about a man right
We
now.
talking about a man, and it can happen with
Mhm.
women too because we have to be stimulated mentally. The older we get,
Absolutely.
that's mandatory.
So how does so what are symptoms of a woman having performance anxiety? They just don't get wet. I
They
mean,
won't respond.
okay.
Yeah, they're not responding. Yeah,
That's not
yeah,
good.
not responding, not connecting.
Sometimes as a woman, sometimes when even like if someone say like, okay, let's get ready and go, and it could be at the drop of a hat, you got a headache, I don't want to go, I don't feel like it, we just go through mood swings, and it just be just like that, to be like, oh man.
It's
And it
off.
go right,
Hmm.
it just so fast. The older you get, it just be like, forget it, no thank you.
Hey,
Yeah.
Latrice. um, so I read it because you work out, right?
Yes.
So can you tell me a little bit in terms of how does lack of exercise affect a person's sexual health?
But yeah, it affects your stamina, because most men, they're always tired. And I tell anyone, women, especially men, because we got this thing about going to the doctor.
Mm-hmm.
And
Hmm.
I was like that too before I started um, paying more attention to my health. I try to go at least twice a year to get a physical. Anybody that wants to work out or start living healthy, I tell them to always go to the doctor and get a full blood work. Men are so scared to go to the doctor because they think they're going to find something. If they do, it's a good thing. Maybe they'll find it in time. But I always go to the doctor. And most men, at the age of 32. Is it a nurse? Did you say there's a nurse on here?
Yes,
Yes.
Gwen.
Gwen, you can attest that most men testosterone levels start dropping at 32,
Yes.
at the age of
Damn,
32.
wait, that early?
And okay, so testosterone starts to drop after your 30th birthday.
Yes,
And it drops by 1% per year.
Wow.
yes,
And so somewhere in the 40s, you have already 10% of men in their 40s are already experienced erectile dysfunction.
yes. And testosterone affects your muscle mass. It affects so much stuff. And I always tell men, because my testosterone level was none when I first started going, and I started getting testosterone shots. And you wouldn't believe, after the second round, I felt like a new person. Once they got my levels back up, my energy level went through the roof.
That's right.
And most men don't know that I said, go get blood work done. Get your testosterone check. I said, I guarantee it's low.
But I think a lot of men are just in denial. Because I mean, they think that maybe because they just wake up, with a hard wood in the morning, that they all right. But
No.
when it comes to performance and you're with a woman, that's different. It may get hard, but it may not be rock hard. Or, or you may have, maybe up or maybe down or just not consistent, And I think some men think that they
a lot of it is shame.
That's what it is.
Denial, shame, denial. Men are taught to keep their feelings and their emotions in check.
Yeah, that's right.
Yes.
And so he'd rather give you a yeast infection with that flaccidness.
And another thing, the pharmaceutical company has really put a crutch on men where they don't really have to go now, because they got all these different Cialis, Viagra, the Royal Honey, the Gold Royal Honey. They got all these things to help, instead of them finding the root cause of why.
I can tell you that.
What is it?
It's systemic metabolic issues, where you said diabetes,
Yes,
high blood pressure.
and that's one reason why I didn't want to take the high blood pressure medicine, because I've always heard that it does something to a man. And I said, I took it for like 2 weeks, and I said, no, I can't do this.
What, you talking about the
Good
blood
for
pressure
you,
medicine?
yeah.
Yes.
Well, they have blood pressure medicines that are not that won't mess with the libido. You just have to ask the doctors. Sometimes, the doctors can order medications that don't affect your performance. You have to ask for them.
Yeah, and I from experience, I personally think that doctors will push a medication onto a patient based off of, from a financial thing, from the pharmaceutical sales, and so sometimes they're enticed and encouraged
Yes.
to prescribe certain medications.
Yes.
It's not really about the patient; it's about the bottom line and the money. And so you kind of almost have to come in that kind of knowing something, doing your research, and have to know that, hey, can I take something else? So this medication,
it's a natural remedy. You don't have to always take medicine.
Questions.
Is it another way? What's his name?
Oh, Reggie.
Is it another way that you can boost your testosterone level naturally instead of
it's and I used to have a list. It's certain foods they call them superfoods that will boost. But the best thing to boost your testosterone is working out. Working out will boost your testosterone up. And just, it's certain foods like avocados, natural honey. Natural honey is really good for that. Natural honey is really good for a lot of stuff.
Wow,
I like it.
And you've always heard the old saying that alcohol helps the man last longer or stay harder.
No,
I've
never heard
the opposite.
Yeah, it actually does the opposite. It actually strips you of testosterone, and it actually turns your testosterone into estrogen.
Yes, That's why you see a lot of people that drink got the man boobs. The men that drink a lot, they got man boobs.
He converts it.
Ooh.
Yes.
Drinkers are yeah.
Yeah.
People that are drinkers.
Alcohol make you fat anyway. So
Yeah.
That's how you get the man boobs. Hey,
Yes.
y'all, y'all better cut the drinking out, man. Y'all be walking around eating bras.
but sometimes I didn't know that the testosterone level reduces at the age of 30 to 32 because
Yes.
you have some men out here they go get us. I mean, it has
Yeah.
nothing to do with
It doesn't happen. It's a very small percentage that it doesn't happen. That it doesn't happen in. It's very small though, but the majority of the men loses it.
Mm.
It starts there. So you may want to think about, when you're a young boy, 15, 16, they're masturbating. They think the wind blow. They get
Yeah.
erection. It used to be a boy in our class, and Booker T. Washington. He would just make himself have an erection anytime.
What?
Lean back in his chair, and he'll just have a full salute. I promise you. And but we were young. We you know what I'm saying? You're young, and then after, it's like God has a mad joke he plays on us, because guys from the age of 15, 16 to 25 to 30 are screwing like rabbits. And we're trying to figure out our mental. We're trying to sync our mind, body, and soul, because that's how we connect, women. And so we don't reach our peak until our 30s. We don't start wanting that sex. It's like a reverse.
Wow.
Right.
So yeah,
That is crazy.
it freaked me out to know that men that it started that young, and our diet has so much to do with
With all that fatty food and
fast food, fried foods,
yes.
a lot of processed foods.
Yes. And I always try to. I might be wrong. I mean, I studied a lot when I first started working out. I read a lot about health and wellness, and I got my certified as a personal trainer. I certified as a few other different things. But I always tell people, black people especially, when they're taking blood pressure medicine, and I always tell them, I say, man, you don't try to get off of it or try to reduce what you take. No, it's hereditary. When they tell me that sends me through the roof.
Yeah.
Because I got off of it. I don't think I don't think it's hereditary. Well, my grandmama had it and my great grandma, but look what they ate. Is what they ate, and then is what they fed you. So it's not necessarily hereditary. It's what everybody in your family grew up eating.
Right.
That's why you got it.
Right. There are some genetic markers.
Absolutely.
Because I've actually went through what's that 23andMe, and not only do they do the ancestry side of it, they also do the health side of it, and they literally was able to identify pretty much all of my family on both sides, the illnesses that I was pretty much predisposed to
Yes.
from being, diabetes being real high on my dad's side to high blood pressure on my mom's side, and also other things too that was kind of like, I was like, wow, I said they got all of this out of just me swabbing out my mouth. And I think it's helpful to know those things. I actually have my kids do it as well, so they can see and be able to see on paper that, hey, they're predisposed to this, so they can start taking start taking preventative actions while they're young, instead of waiting until they say, oh, you got to take now your blood pressure high, you got to take high blood pressure. Not because I knew exactly, like, when my blood pressure, I had always had low blood pressure all my life up until in my 40s, and my blood pressure just gradually started to increase. I wasn't doing anything, I mean, I ate healthy. I wasn't really, eating bad, but I was like, wow. I said, well, my blood pressure is like going up, like it seemed like for no reason. And my doctor told me because of the fact that I was predisposed to it. So I had to start making changes in how I ate. But see, again, had I known when I was younger, I could have probably, curbed a lot of the things that I probably was eating and doing and habits and
Yeah.
stuff at a younger age. And so
Yes.
I think that's important for for young folks to know. Don't wait. Same thing with life insurance. Don't wait until you need it to go out and try to get it.
Yeah. Exactly.
Um, so there are some other sexual health practices that's helpful and useful, especially for people that are single or promiscuous. Ensuring that you're going and getting STD screenings on a regular basis. I don't know how frequent what's the necessity. How often should people be going to get STD screenings if you're
Well,
single?
if you're having unprotected sex.
How often? Like after every partner? Or?
After, well, you might have to do it a couple times with the same partner because you can't trust them. So, yeah, what you think you got is may not be what you have.
Right.
So I would say annually, at least annually, go have your pap smear, your prostate check, all your wellness, and have those done. They can do it with blood and urine. It's not always a vaginal swab.
Yeah, they ask you to pee in a cup and
Yep.
they go check it out. Come on back.
Well, that's good to know.
Mm-hmm.
Well, but they can't men. So as far as men getting their prostate, now this is one thing I heard. Someone just recently told me this, that men now can go and have prostate exams where they actually knock you out. They actually give you a general anesthesia and they put you to sleep to check your prostate. Did you know
That
that?
sure is expensive.
Yeah. Yes.
They so scared of that stuff, though. They really scared of that.
It's men out there that have a reason why they won't go to the doctors because
They have a phobia.
They have a phobia by somebody sticking their finger, especially if it's another man.
Yeah.
Male doctor.
Yeah.
And that's a slow growing cancer. And it will fester for, years. By the time you figure you have cancer,
because you don't feel it. You
metastasized.
can't feel cancer.
It has spread.
It's just there when
It's
you
a
go to the
very
doctor.
slow growing cancer, prostate
Wow.
cancer.
Yeah.
The prostate cancer, that's the one they give you the doctor can, what is it called? They can send a kit in the mail and you defecate in it and send it back.
Oh, that's
What's-
your Cologuard.
That's
Colonoscopy.
Cologuard. Yeah, Cologuard. My bad. Cologuard.
So have you had your prostate checked?
Yes. And I had the Cologuard too.
How often do you suggest that they do it?
I would say when you get a physical once a year.
Yeah.
Once a year?
Yeah, and they do a blood work with it
That's
called
a
a PSA.
Yeah, they check your PSA.
You check your PSA too, and that will see if you have any cancer antigens. So yeah.
Yeah. And that's another
Yeah,
thing.
whenever I go, I tell them to, when I get blood work, I tell them do it all. Whatever y'all offer, do it all.
Yeah,
Right.
because as far as insurance, if you have health insurance, your health insurance should be covering all.
Yeah, it covers. Yeah, it covers.
all
It covers.
your preventative care checkups should be free.
Yeah, it is.
Ultimate sex life, and you want to be able to have sex into your 70s and 80s. Yeah.
Yeah.
I went on vacation. Well, I went to hedonism. It was some old people there. It was some old people there, and that gave me hope. That gave me hope.
I like it.
Yeah, and they do have old people there.
Yes.
Statistically, I want to give you that, guys, just so you can know this how important it is as far as getting the testing done for STDs. 2.4 million Americans actually have been diagnosed with a STD or STI, and half of that number are those that actually have AIDS or HIV. So that's some people may think that that's not really a large number, but it is to me.
It is. Yeah.
Just to know that you can be still exposed to
I
it.
think everybody knows somebody.
Yeah.
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 And that's a lot.
And it has an incubation period. That stuff sits morbid in your body, and then all of a sudden it just pop out.
Yeah.
It's crazy.
But you just don't hear about it anymore
You really
like
don't.
you used to.
Well, you just hanging around more responsible people that ain't getting AIDS and gonorrhea, syphilis.
Right. Cause
Yeah.
People,
you got
the older we get, the more responsible.
right.
we
Because
become.
you got I guess I don't want to say young because people still getting stuff, but chlamydia, gonorrhea, syphilis, and herpes are like the most popular STDs.
Yes, and they resurface in nursing homes.
I'll do it.
Oh yes, STIs increase in nursing homes. Old people
Why?
lonely. Old people become lonely, and they start getting it back in.
Wow.
It's just not okay.
Yeah.
So I'm trying to think of. That's crazy. I don't even want to look. I don't even know if I even want to look
You don't even want to picture that.
Right.
But if they still have that libido thing going, I don't know.
Huh?
I mean, if they still able to get it up, I think they should use it.
But I'm sitting up here thinking,
I think you shouldn't waste it.
But I'm sitting up here thinking, like, if you're in a nursing home and you're around the same people, like, who is it that's bring? Like, don't you get the STI? Would it be from somebody outside of the nursing
Those
home?
old men be.
You would be surprised at some of the nurses because I worked in a nursing home. When I was in the military, I worked in the medical field and I got out. You'd be surprised at some of the nurses aide that will have relations with some of those men in the nursing home. You would be surprised.
That's where it came from. It was the nursing aide that
yes.
Mess around and get the worms.
Yeah.
That's what your grandma used to say. Mess around and get worms.
Crabs.
So I'm almost dead.
That almighty dollar be talking.
So let's talk about relationships when it comes to sexual health.
Oh yeah.
Which is, I think of big importance because I know there's a lot of people that watch this podcast that are, they may either be married or they have a significant other, and I think about it like this. Usually when you meet somebody, your relationship is new and it's fresh. Everything is, usually on and popping. Y'all just, I don't even know the right word for it, but y'all living in sexual bliss. But as time progressed and you been with that person for a long time, and one or both people can start experiencing issues with their sexual health, whatnot, if it's coming from their own personal health issues or emotional,
mental health,
and mental health as well. So how do you, I guess let's start talking about in terms of how do you have that conversation with your partner without making them feel, either shame or feel in some type of way. Is there, what's a good way to approach it?
Definitely got to have an open communication about that. And if you are friends first, I don't think it should be a big issue. Now, if we're just newly dating and you chose to hide that deficit from me, then that's a different topic. That's harder to discuss. But somebody that has a history, I think it'll be easier for you to sit down with your soulmate and tell them, hey, we missing something here. And maybe we can fix it together.
Yeah,
I think it's a good way.
That way they don't feel like it's their problem. It's us. And
Because a lot of times neither one know where this came from, how to fix it, what to do.
Right. And you definitely got to pick the right time. To have the kind of like, don't wait, don't be in the middle of the bedroom. And y'all getting it in, and then she get frustrated, and you know what I'm saying. You got to get your shit together.
But men do stuff like that. They don't never want to tell. They'll just be like, "Oh, I'm just not in the mood." But they don't never tell, and they'll do foreplay forever. It's like, okay, so when we gonna get to the good part? They just stubborn people.
Or oral sex forever.
Yeah.
And see, I'm a 70s baby. That's just a prerequisite. That don't do that. That don't impress me.
They working on trying to get it up, and it's exciting. I don't know what it is. I think it's just exciting to them.
Are they doing it and trying to jack up at the same time?
Yes,
trying to get it up while they. That's
really. I mean, because I work out, I have no problem at all. I can see.
That's consistent with working out, Reggie. I'm telling you, they're good. That blood is flowing.
Yes.
That blood is flowing.
It depends. I take supplements. I take different I take a vitamin every day, and it says I can see some on Facebook, and right.
You are very blessed, sir. Because some men get turned on by ass and titties, everything, just little stuff. It don't take
Yeah.
or working out. They just naturally turned on.
Yeah.
Right. And us women experience the same thing as men
Yeah,
as we grow older.
I think we afraid too sometimes. Like when we get ready to go through menopause, like a lot of women think it's gonna dry out, or they're not. It's not gonna be right.
Well, some of them experience that. It just depends on where they are on the spectrum of menopause. Some women go through the the hot flashes, the night sweats, and some of them do lose the sex. Their sex drive,
the libido,
the libido.
Emotional too, roller coasters.
Oh yes, that's definitely emotional.
So what do women do? I know men testosterone working out. So what do women do when they lose their libido? Is it anything
we go to the doctor too? We go to the doctor, but it's not covered. It's no copay. It's $452. You want to know?
Oh, really?
They have something called hormone replacement therapy.
Okay, I've heard of that.
For women, and in different forms. There's different forms.
You don't think it's just the loss of estrogen that causes a woman to lose her?
3 hormones that we battle.
What are they?
Estrogen, testosterone, and progesterone.
Yes. Yeah, women have testosterone too.
Yep.
Yeah.
You start noticing women with a lot of facial hairs and
they got a lot of testosterone. Yeah.
Yeah. Aggressive. Let me go through that. Let's take a pause real quick. I want to go through some of the comments real quick. We got Shay was saying that colonoscopies is best to get done every 5 to 10 years. That's if your results are negative based on health, right? And I think another part that plays into that is your hereditary. Like if you have like a recent parent or someone that has had diagnosed, they usually want you to have it done a little bit more frequent than that. And then Latrice actually said, what are some of the symptoms surrounding prostate cancer? Like symptoms of?
Well, the stream it will. It's also something called BPH, benign prostate hypertrophy, where the man's prostate enlarge over time. That's a aging thing. So that doesn't mean that you have cancer, but it's kind of treated the same way. Of course, cancer is malignant and you have to go through chemo, but it's kind of in the same way. It obstructs the flow to urine and for semen.
So I got a question. I know because when men got the urinal, I know a lot of them, I go to the bathroom the same time as another man, and they'll be in the urinal. It's like they're there for a long time, and I can push my bladder, and I could less than a minute, I'm done, and they still in there like, what?
Yeah. BPH, the stream becomes unsteady, skittish. You'll hear them in the bathroom.
Yeah.
They need to go to the doctor.
Is that what? Yeah, because I was like, what? I thought something was wrong with me.
Yeah, no. That's a sign. Warning always comes before destruction.
Right.
Warning always comes before destruction. Our bodies will tell us when it's off kilter.
Yes.
Listen, right?
You have to listen to your body. You have to.
Latrice said long foreplay is annoying.
Annoying, yeah.
Thitero, the comedian, don't change it on all men. A lot of you women don't get wetter than y'all used to.
Right.
Okay.
I can agree with that.
Estella, how you doing, Estella? She said the conversation should happen before you become intimate. But people don't really communicate. They're ready to turn up. Yeah, it's hard. I think it would be a little bit hard to just start having a conversation. Y'all thinking y'all about to have sex, and then somebody just pop off and start talking about the fact that somebody's not performing well in the bedroom right before you get intimate. I don't know about
that will make that anxiety I talked to you about.
Yeah.
Performance anxiety.
Yeah.
And sometimes once a woman or a man gets that in their head, there's no going forward with that person.
Yeah, the Thutterow said, he said, I will help you woman to pay that $452 if they go keep
And that's it does more than that. It gives us mental clarity. It stops the hot flashes. It gives us stamina where we're able to work out.
It also affects our mood.
Yeah, now we can get out for antidepressants. Yeah, all that comes with menopause.
I talked to I talked to a lot of men, but men who are married and do have wives and where they're going through things, and I say, hey, it does not have to be the end of the world. This is not, you don't have to accept that, and she doesn't have to accept it, So I frequent times have sent the link, for the hormone replacement pellets, so they, the man can look at it and he can have a conversation with us, and I tell them, hey, don't just shoot because they're gonna ask you what the hell you got that.
Yeah, and I mean they got things to stimulate you in the bedroom, conversation throughout the day will help you get going.
Yeah,
they got
porn,
all kind of porn. Yeah,
toys,
cock rings.
The rose. Don't forget the rose.
I still don't have one. I want one. About that
I've never had one.
I just don't believe in the toys. I don't know.
Oh, so you don't have no toys?
Not a one, no.
Oh, girl.
I've always been taught that's a man's job to do all that stuff, so you don't need toys. But I do want to do the rose thing. I really do.
So what happened when you buy yourself? I mean, you ain't been in a relationship all your life, so what happened?
And that's one way. That's another way we lose our libido too.
You think so?
Not engaging.
Yeah, inactive.
Going periods of time without connections.
I think it's exciting.
Because I believe that because you get comfortable. Mm-hmm. You get complacent. You get comfortable with the fact that, hey, I'm not having sex, and I was,
I don't miss it or something. It's right. Like gonna go. You think it dry out?
Oh yeah, absolutely. Estrogen, it dry out your eyes. Women that have estrogen controls our lubrication in our eye. It affects our hair growth. Our hair starts to thin. It affects so many. It's been linked to cardiovascular disease in women, menopause. So it's a lot of reasons why we should keep our sexual health at its optimal. Because it's always linked to something else.
Latrice say prolapse.
A prolapse uterus?
That's what it's called. A dry uterus is prolapse.
No, that's when your uterus basically you start falling.
Yeah,
that happened. That actually
into the vaginal.
That happened to my grandmother. I thought that was because of the fact she had 11 kids.
Yes,
from having
lost the elasticity and the muscle structure. And
I didn't know it could collapse. Oh Lord!
Too. Your cervix can evert too, be tilted.
Mine was tilted.
Mine's still tilted. Swagger.
Oh goodness. Okay, look, Thutterow, he talking about what's the difference. Now that's a different conversation. What's the difference between a woman squirting and a woman having an orgasm?
I'm not gonna say nothing. Well, y'all want me to say something professionally about that?
Yeah, please, yeah.
Oh, I'm gonna get beat up. Y'all don't come for me because I'm telling you this. I'm gonna tell y'all this on a medical standpoint. Don't come for me because I like to fight. Listen,
I got
don't come for me. This is medical. It's 2 glands on the side of the uterus. That's where we start to make moisture, and that's where our orgasms originate. It's on the side. There you have your inside. You have your G spot,
right?
Which is your stimulator. You do not orgasm from the G spot. That's your excitatory gland. Mm-hmm. But you have 2 glands that sit on the side of the vagina. Those are what leak your orgasm. It cannot hold that much as women squirt. It's not physically possible. So what happens is as you're having an orgasm, and it's the pressure that's built from the orgasmic release, you also leak urine, and it's diluted.
That's what.
So it is.
You also it's urine and orgasm.
Really?
Nobody is wrong. But it's definitely urine, and y'all come with me and tell me y'all ain't peeing on y'allself a little bit, because y'all over 50. Don't come telling me that. Don't come for me. I'm telling you, I'm gonna do a Kegel exercise.
So how can you stimulate? Like, I'm curious. Like, these two pressure points that you speaking of, I know it's a difference between the orgasm and the gland.
Your orgasm.
So can you touch them? Like, because I've never experienced the vagina.
They're like a pea size. They're so
where they at, girl? I want to know.
I'm gonna look them up for you.
You should have brought a diagram. A prop. You should have brought a prop.
I should have.
You look on your phone. You can Google it, huh?
Yeah, I can Google it real.
So
fast.
if you like my Aunt Flo, she is like slow. I'm so happy not to have her in my life again. But she is slowing down right now, so I'm excited about it because she should pack her bags and leave.
Right.
But at that point, you losing your estrogen, right? I'm gonna have to replace my estrogen to keep my libido up. That's what you're saying?
At some point.
Really?
Mm-hmm.
Because I like fucking.
I mean, I like it too, but I don't even.
I don't feel my sex drive depleting.
Without your hormones, your tolerance for people are like really low. It puts you in a funky mood sometimes. That old menopause thing, you know. So I don't know. I can't vouch on that because I don't like the sight of a man every day. Just when I need it. That's me.
I feel that.
I like black love though, you know. Respect it.
So what should we do, like in that instance, like to increase your libido without taking medicine? Like, is it any?
It's herbs.
It's still in
food.
the food, like what he said.
In your exercise, we gonna lose elasticity. We're gonna lose. It's just part of the aging process. Some things you can't stop, but you can help.
So when they go get the dream catcher transformed, they could fix all of that again if you go to the doctor.
I'm gonna tell you my first experience. I've had hormone replacement therapy, and I went and they do your blood work and they see what you're missing in your hormones, you know, and they replace them based on your loss. So I menopaused early at 40, but not premature. Okay, so I had nothing left when I went for my pellet replacement, my hormone replacement therapy, and it was like greasing an old bike, baby. Clarity. I was like, I had called them. I say, hey, is things supposed to be thumping and going on down there? Is my clitoris supposed to be past my labia?
Oh my god!
Like things. Like my body recognized the deficit.
Yeah, that's the same thing with testosterone replacement. Testosterone, it's the same thing. It's like
in years.
That sounds good, girl.
Yeah.
It's like they woke up a sleeping giant. I was like,
exactly.
I was like, what the hell? I mean, I was waking up at 3:30 in the morning to go running, and then work a 12-hour shift, and then get tired.
So let me ask you this, Reggie. So when you started taking getting your testosterone shots, you said after your second dose is when you noticed the change after the first.
Yeah. The second dose, because I got they had me scheduled for one every 2 weeks. So I got the first one. I really didn't feel nothing. Then after the second, like 2 or 3 days after the second shot, it was like something just opened up. And I was like,
see, he understand what I'm talking about.
Yeah, it was like what the hell?
It opens up a lot of other avenues. Those hormones cover a lot of other things, like your mental clarity.
Yes. Yeah.
The mental fog lifted. I was like, oh, I can see clearly now.
Yeah.
So did it make you horny?
Oh, yes. Absolutely.
Oh, yeah. Yeah.
Hide your cousins. all that. Yep. Old hole. Yep. Not a good idea without a man. Yep.
Wow.
Yeah,
So
lower
what
your standards a little bit.
So if you cannot afford
Just a little bit,
but if you cannot afford the hormone replacement therapy, what do you suggest besides exercise, like a vitamin B, a vitamin A, or some type of, you said it's in food, but like what else do you suggest to replace that the doctor would give you that would be a natural?
The doctor's not gonna tell you about
They're not going to, that's why you do your research. That's why I say, I tell everybody,
there's no
Google
specific thing
you'd have to go see somebody
that
that's
can
into
replace
holistic,
estrogen. And
an alternative meds, people that specialize in this, that a doctor is not,
yes,
because that's how they make money.
It's a business.
yeah. So they're not going to tell you.
Right.
So I Google, just Google. That's Google is your friend. Trust me.
Yeah.
You're right about that.
Well, we do have with technology today. Medical technology is so elite. It's so on fire. It's like
you can ask AI probably tell you.
Yeah.
So many choices. It's other things you could do. You even have women in their 70s, 80s go for uterine ablation, where they're going to get their vaginal ablation, where they're going to get their vagina restored. So sex is important. Sex, they want to still have sex. They want to keep up with their new boyfriends or new got a new relationship, and they want to shed those old cells on the vagina wall and get them some cells. So that's what they burn them off. They do it a couple of sessions. There's all types of treatment if you want it.
Yeah, I had a uterine ablation back in my 40s. I had one done.
Just feeling good. Did it make it tighter and stuff?
Well, I didn't have to worry about no more periods after that.
Well, hers was uterine. Vaginal ablation.
Oh no, I had a uterine ablation.
Yeah, she did hers for fibroids, for thickening of the wall.
No, because when I was having cycles, it was from the bleeding and the pain from the bleeding.
Okay.
So that was an alternative then to have a hysterectomy at that time. I wasn't really a true candidate for a hysterectomy, so that was like the next best thing. Yeah. But that was I loved it because that was in 2004 and I didn't have to worry about having no more periods. Girl, look, I was always ready. I was always ready. Yeah. So let's go back on the couple side. So you date somebody, or you with somebody, and you have the conversation, right? Everybody's not always receptive. What happens when that person has not taken any steps to make any changes in their health or to try to help improve the intimacy between?
That is totally their responsibility at the end of the day.
But what is the other person supposed to do?
You have to do what's best for you. And most people say, well, I don't want to cheat. Well, you're going to cheat. So what do you do first? Leave. Yeah, that's what you do. You don't put a person through that. You tell them you have to have a sit down and say, hey, if I can't get this intimacy, we can't connect on this level, you're not willing to do anything to improve our sex life or make any efforts. Because it's trial and error. What works for one person may not work for you.
Right. Yes.
So you have to try different things until you guys get to a common ground.
But I don't think that you should leave a person because of the intimacy.
Depending on where you are.
But 80% for me. If you ain't coming 80%, the other 20%, money, all that don't even matter. You gotta have 80% at my time right now in my life. But for the people that can't, intimacy is not everything. At some point, like you said,
other levels.
It's gonna come at some point in time in your life where you're not gonna be able to. You said stuff break down. Right, absolutely. Right. So but you leave a person.
But those are things that you cannot change.
Control.
Those are things that you cannot. But the things that you can control, like going to the doctor, going to get the physical, getting some help, mentally to help with your depression or to help. If you're not trying to help yourself and you're with somebody, you just going to expect them to accept. You're not being 100% of yourself. You're not contributing 100% of who you are to the relationship.
And that's kind of being selfish to your mate.
It's being selfish.
Yeah.
it's being selfish to your mate.
It takes two. You can't expect that person to care, and you can't depend on that person to provide your happiness if you're not, you're not trying to be happy for yourself.
At least try. If you got to be willing to try.
Yeah.
Right.
Yeah, some of the hardest decisions when you're trying to make right decisions, those are some of the doing it the right way. It's like the hardest choices that it's so hard to do things right sometimes.
Yeah, sometimes,
and it hurts.
Or even admit to it, because first thing you got to do is be honest with yourself.
Absolutely.
That you absolutely got an issue here, and that it's affecting not only you but your mate. You know what I'm saying? So that requires you to care. That requires you to care about the other person's feelings and their feelings not being met.
Thank you, Theodore. Thanks for joining us. We'll be back again next Wednesday. We appreciate you. But go ahead. I'm sorry.
Yeah.
Yeah. So let's see what we got left here. I think we talked about most of the things that's left on here. But but definitely to your point, definitely couples therapy. I mean, I would say it shouldn't have to be a last resort, but I mean, definitely if nothing else is working, and then, maybe trying to get help from friends and family too. Some people, most people are real private. They don't want their family knowing their business or whatever, but maybe somebody in their family that can talk to them.
Or have experienced it, that they trust it.
Right.
But closed mouth don't be fair. You got to tell somebody. You got to be willing to open up and find out what avenues you have.
Yep.
It's kind of hard. I would be sad if you catch her dried out. I would be so sad. I don't think I would want to live without her. It's hard.
What do you call your
the
thing?
dream catches?
That's the
catch a fantasy. Yes, ma'am. I'm just saying, like, just right now, I mean, I think if a man's libido, if his private part didn't work, he would be so sad. Because what else would he have to live for if it didn't work? I don't know. That's where I'm at right now.
A lot of them,
I don't know.
By that time they have money. So, money, women will pretend for money.
I guess.
A whole bunch of stupid stuff for money.
Yeah.
A lot of people stay in relationships.
For money,
for whatever they need, whatever that need is.
I agree,
but not all their needs are being met,
and they're probably getting them met elsewhere.
Exactly.
That's problems.
Yes,
could be potential problems.
Huh? Yeah. Yes. So I think also too, I'm gonna bring up this last point before we exit out of here. A lot of who we are and a lot of what we do when it comes to our sexual health and what our thought process is as far as what we consider as normal. A lot of this is controlled by cultural and society. So culture believes society saying that it has to be this way or that way. But I think that it's important as individuals that we understand, and all of us to have a true good sexual health. We have to know ourselves, right? And in order to do that, you have to go get your checkups. You have to, get therapy wherever not if it's mental health, if it's mental health therapy, physical therapy, physically. You have to have those things as in order for you to
get a second opinion too.
Yeah,
get a second opinion if you're not, sure or comfortable with what the doctor told you, or the doctor prescribed you medications that you might feel that will interfere with your sexual life. Ask the pharmacist. All you got to go to say, hey, what does this medicine do, and how will it affect me?
Yeah.
Ask questions.
Will tell you. The pharmacist will tell you.
But also sometimes it doesn't have to be the libido or the male female part. It's just that maybe you're just not attractive to that person, or maybe he's not attracted to you, and it's just
people do fall out of
absolutely
that will happen.
It don't have to be. You go to the doctor, ain't nothing wrong. He just don't like you no more, or she just don't like you no more. It's time to move on. It's not you. It's not him. It's just like you say, you fell out of love.
Yeah.
Or they just something about
you
them.
grew apart. or you just grew apart, just grew in different directions.
Yeah.
It can definitely happen.
And sometimes it's sexual satisfaction.
That's too good.
That you keep trying to reach that satisfaction with that mate, and it's not about sexual health. It's just not a connection. It's no, no connection. You won't get the intimacy.
Like him on the phone. I mean, on our guy. He the wind blowing, you get up there and do all that stuff. Yeah. Blowing on the wind.
Yeah.
You hang glide.
That's really nice.
Yeah.
But those are the glands.
Absolutely.
So you read that. I don't know how to pronounce that.
It's skin's gland. That's what produced our erection.
It's spelled SKENE apostrophe S glands.
And it
says are located in the
vestibule of the vulva
around the lower end of the urethra.
Mm-hmm.
Oh,
that's what she had, huh?
So it's close. So your urethra is what carry the urine. So it's close. So when you climax, that pressure is put on that urethra. So it's possible for you to squirt. It's not a bad thing.
It's just pee.
And sometimes it's
exactly. It's just pee.
So it's the man. I mean, the man, he do all that stuff too. So what's in that? Is it pee up in there too? Because it come out the same hole.
Oh, the semen?
Yeah.
Oh, they piping different. they whole piping. You gotta ask God, because they whole piping. You gotta look at the picture, girl. They got loops and channels and.
So do you pee when you let it go? Tell the truth. Do you pee like when you let it go? Sometimes, Mr.
No, but sometimes right after I have to go use the bathroom.
They pee after.
Okay.
Yeah.
You don't no little pee come out.
No.
You can't do it at the same time.
No, we can't. No, I think that's impossible to do it at the same time.
Okay.
Yeah.
Okay.
But those glands are right there by the urethra where the pee comes. So if you're getting the right amount of pressure, it can release, and you get the squirt. But listen, that's a thing that we're here today talking about that. But Playboy hustle back in the day, that was not a thing.
No.
Squirting. Back in the Playboy hustle days when you had the Playboy books.
Yeah, I don't remember that. That's interesting that you say that, because you never heard nothing about squirting.
There was no such thing as squirting.
But what turns y'all on, Reggie, to squirting? Do you think it's sexier for a woman to squirt, or you don't have a preference?
I don't have a preference, but what turns me on? I know me and probably a lot of people.
I was just talking about you though.
Do what now?
I was just talking about you because you Superman over there.
No, squirting. I mean, it does nothing for me. Like I always thought it was pee, so it does nothing for me.
Do you think?
Have you squirted before?
I don't know. I'm never down there. I know.
She said, "I'm never down there."
I'm never down there.
You would know if you did. I have. You would know if you did, because your whole sheets would be. I mean, that whole area in the sheets would be completely wet.
We have wet spots, but I don't know if it's a squirt or not. I mean,
you would know.
It probably is.
It's like if you peed in a bed. It's that much. It's that much wetness. It's a lot.
I'm savvy. I am dick savvy, and I'm definitely dream catcher more savvy today. Thank you.
She said, "I'm definitely dream catcher."
I'm that was really good. I like that. Thank you, Reginald.
You're welcome.
Let's see. Before we close out tonight, let me see if we got anything else in the comments. Thank you, Latrice. Pepper, that's my cousin, Pepper. She said, facts, you have to be whole. That's definitely true.
Mhm.
Damon says, learn behavior. And Latrice is agreeing that is piss. Thanks, Damon. Jarvis
Reginald,
said,
can I
couple
ask
couples
you one
in.
more question while she checking?
Yes.
I want to know, like, when you hold, since you Superman, so your nut sacks haven't dropped yet. So when you hold them, you know the
How
little
you
line.
know?
I'm asking them.
Go
So
ahead.
do when you hold it, do it like cause you to get aroused? Like, do y'all like that?
It got to be real gentle because those things are really sensitive.
Mm-hmm.
So will it
Real
help you to
sensitive.
ejaculate? Like, if even if you got that soft touch, is it arousing for you?
Yes. Yeah.
Okay.
Did you have anything else
Mm-mm.
contribute? Did you want to tell the viewers how to find you? If they want to find Miss Gwen.
Oh yes. You can find me on Instagram or Facebook.
She has a tell them a little, just real quick, briefly. That she
I
has.
have a business called Snatch to Perfection. It
Ooh.
is a post-op plastic surgery aftercare business. I'm mobile. I set up and come to you and massage you after you've had your 360 lipo and your BBL and tummy tuck. I'm the person that takes care of you and give you all the good advice to get you snatched back into business, because surgery is only 40% of what you're going to look like. 60% is your aftercare. That's why a lot of surgeries are round 2, round 3.
So you know the doctors too, huh?
I know some good Picassos and Da Vinci's, because that's what I
So
call
can
them.
a good massage get the dents out of your booty?
That's where you do the cups. That's where you do the cups, don't you? The cups.
Superman, hold on.
It's cellulite.
It is.
Wood therapy helps with that.
Wood therapy?
With there.
Girl, need that.
But it happens. It's part of the aging process.
Is she-
Gain weight,
is
lose
she-
weight, gain weight, lose
Yeah, and
weight.
she also does cavitation.
What's that?
Explain it.
It's a cavitation is a non-invasive liposuction where we use radio frequency and ultrasonic waves to contour the body.
I've had that and it works.
You done had everything.
Lipo,
Boy,
lipo,
I want to see you.
lipocavization and skin tightening, RF skin tightening.
Yes, radio frequency. Yes.
Yeah.
I'm telling you, she's a beast, and she's petite, and she a beast. She be, oh boy, I don't know how she do it with them little hands, but she
Turmeric.
got. But
Turmeric.
she handles patients, and she got clients with her business. So,
I
and she's
love
in the
it.
Houston area. So, ladies, if you plan on getting surgery, or you had surgery, or plan on getting another round, I don't know how many rounds she accept, but get in contact. Snatch to
Perfection.
She's on Instagram. She's highly
I like
referred.
it.
Numeral 2,
I like
ladies, to perfection.
And what about you?
Nothing. I have. How much more time we got?
Y'all talking about how folks can find you.
Oh,
They might be looking for you.
girl.
Maybe looking for the dream castle.
Catch a fantasy. No, I'm on Facebook, of course.
Not on the
As-
dream catcher.
No, not ever. Not ever. I don't share ever. But I'm on Facebook as No Talking. Also on Instagram as Cold Winters.
Okay. No talking cold one.
Okay, and what about you, Reggie?
Well, you know, Reginald, Navy Heart, I'm easy to find. Ain't but me and my son on there under a name like that. So
All right. Well, thank you guys, and thank you, Latrice, for putting up Miss Gwen's, because she got it right, right? Snatch. She got it.
Yes,
She got it.
Snatch to Perfection. Yes.
All right. And let's see. And I think that's all that we have for today. So thank you guys for joining us. If you haven't already and you're watching this on YouTube, please be sure to like, share, and subscribe to the channel. We are already up at close to 2,700 subscribers, and just within 6 weeks, that is awesome.
Yes.
You know, trying to get them views up. So, you know, please like, share, and subscribe. You know, if you can, if you haven't had a chance to, we're going to be putting out the actual clips from this later on tonight or tomorrow. But if you catch a clip and you like it, go ahead and check out the full show. That's what helped me build my watch hours. But I appreciate you guys for tuning in, and thank you for all of your support. Thank you, my guests. Thank you, Reggie, for
Thanks for having me.
But you know,
Thank you.
coming in being a very good contributor to the conversation. Thank you guys for the comments and questions, and thank you to my two guests. We'll be back next Wednesday from 8 to 9 p.m. So be sure to tune in live with the Unofficial Sex Therapist. Thank you, and have a good night.
Good night.
Good night,
Bye
everybody.
bye.
Good night.
Bye, Reginald.
Bye. Bye, Dreamcatcher.
Thanks for listening to this episode of Unofficial Sex Therapist. Please be sure to like, comment, and subscribe so that you never miss an episode.
All right.
That's a real